Hello, everyone. I would like to start by thanking the organizers of this event, International Conference on Food, Nutritional and Dietetics, for the opportunities to share our results with you. Let me introduce myself. My name is Marlene Escobedo Monge. I work as a pediatric researcher at the Faculty of Medicine in the Valladolid University in Spain. What I'd like to present is our result on zinc and copper status and copper-zinc ratio in a series of cystic fibrosis patients. If you have any question, I'll be happy to answer them at the end of this presentation. In my presentation, I focus on three main issues. First, I'll give an overview of cystic fibrosis in the context of chronic diseases in childhood, then a brief description of copper zinc in human beings, and finally, I outline what the study consists of. Okay, today's topic is of particular interest to those of you who share a goal of improving the quality of life for people, especially children, who suffer from chronic conditions, like cystic fibrosis. By definition, a chronic disease is a long-term, non-curable condition that sometimes some of them, the chronic condition, that are by definition chronic since onset, for example, cystic fibrosis. Now, ask yourself, how many children and adolescents suffer from chronic diseases? Thanks to advances in medicine and improvement in public health services, more than 90% of children and adolescents with chronic diseases survive beyond the second decade. In 2017, the prevalence in chronic diseases in childhood and adolescent is estimated between 15 to 20%. So some of these conditions require daily and lifelong medical treatment. Okay. In this slide, I would like to see that the cycle of life in chronic diseases. That is, the chronic diseases that appear during fetal life, infants and childhood, and even adolescence. We must add the chronic condition, the non-communicable diseases that appear into adulthood. In this population, these non-communicable diseases can appear at younger age and be more severe. For example, a child with obese or overweight is more likely to remain obese into adulthood and suffer from non-communicable diseases such as cardiovascular disease, hypertension, diabetes, and even cancer at younger age. Children and adolescents represent nowadays more than a third of the world's population, and more than 2 billion were affected by non-communicable diseases. These chronic diseases affect the growth and development of all these children. And it depends on the onset of the disease, the system and organs involved, the severity, and other factors. Okay. Cystic fibrosis, as you well know, is a chronic autosomal recessive genetic disorder that affects respiratory and digestive system. Sorry, I have a cold. Okay, nowadays the prevalence of cystic fibrosis is about 70,000 people worldwide, and the incidence in Europe is about 1 in 3,500 children. But this incidence is less in other ethnic groups. For example, is 1 in 3,100 Asian American children. Sorry. Okay. Cystic fibrosis is a chronic disease that affects all growth and development in all age. More than half of population survive over 18 years old, and the lifespan is more or less 40 years old, but in some Western countries, they survive more than 70 years. For example, in UK, 79 years old, in Ireland, 76, and in the United States, 82 years. And the death is caused usually by pulmonary complications. The nutritional status and gland functions are closely associated with life expectancy. In this patient, is important avoid colonizations, and after that, the chronic infections in pulmonary infection. They require nutritional support according to the nutritional status, that is malnourished, normal, overweight, or obese. It's important to take into account that early diagnosis allow us to give them an adequate diet, an adequate replacement of lipolose vitamins like A, D, and K, and replace of enzymes according to pancreatic insufficiency. Another top important consideration in these patients is that they can suffer with non-communicable diseases. We need to try to avoid to reduce the impact of their body. It's important to control diabetes, obesity, hypertension, and other cystic fibrosis related to bones, liver, and renal. It's important for nutritional support. Now, what is the status of copper and zinc? Zinc is an essential macronutrient for all life forms. In this slide, you can see acrodermatitis enteropathic image. That is a severe manifestation of zinc deficiency. The absence of zinc in the diet is unable to proper growth and development. Get sick more times, and the times of the disease is prolonged. Nowadays, it's considered the fifth disease worldwide. It's important in the duration of infection as common as diarrhea, pneumonia, and malaria in developing countries. In developed countries, appear in patients with lifelong diseases, and in those who suffer from an inadequate balance between loss and intake. It's important to take into account that zinc is related to proper food that contain high level of protein. And one cause of the zinc deficiency is the amount of unabsorbable zinc. Copper is another macronutrient that is less studied. It's part of the development of red cells, the immune system, the development of brain, and together with zinc is part of the superoxide dismutase enzyme. We need to take into account that there is a proper balance, should be a proper balance between zinc and copper in our body. We hypothesize that we would like to know if this patient has suffered from an zinc or a copper deficiency. That is in the nutritional unit of pediatric service of the Valladolid University Clinical Hospital. We carry out this study. And the main aim of this assess was evaluate zinc and copper status and copper zinc ratio in a series of 60 fibrosis patients and the relationship with other biomarkers, nutritional biomarkers. In this slide, we showed the design of this study, that it was a cross-sectional study. We carry out an anthropometric assessment of the basic evaluations, weight, height, etc. We perform at the same time body composition, bone densitometry, and basal energy expenditure. The week before to the anthropometric evaluation, we perform a dietary survey and we evaluate macro and macronutrients with a 72-hour prospect dietary survey, including one of the weekend days. We carry out a complete blood count, a complete biochemical analysis, and the activity of acute phase proteins. In this slide, you can see the cutoff point that we use to evaluate serum zinc and copper, the relationship of those two elements, and dietary zinc intake. When copper zinc ratio achieve the unit, this shows that it's characteristic of an inflammatory condition, but it achieved 2 points. It shows a severe bacterial infection. In this slide, you can see the parameters that we use to evaluate if our city have suffered what kind of deficiency of zinc suffer. We use the parameters recommended by World Health Organization, UNICEF, International International Atomic Energy Agency, and International Zinc Nutritional Consultative Group. They said if population, more than 20% of this population have started grown in children under 5 years old, or more than 25% of the city have dietary zinc deficiency, or more than 20% had hypoglycemia, this population suffer from at high risk of zinc deficiency. Okay. In this study, 60 fibrosis patients took part, from 2 to 31 years old. 59%, 10 cases, were women. Results show that the mean serum zinc and copper were normal, but the copper zinc ratio was high. The mean dietary zinc intake was normal too. There was no relationship between serum zinc and copper and age. However, we found a significant relationship within serum and copper levels. At the same time, serum zinc was associated with body index and weight for height. Dietary zinc intake was associated with energy intake and weight for height too. And serum copper also had a direct association with body mass index, bone densitometry, and negative association with vitamin C intake. In this series, only 3 patients had hypocalcemia. 4 patients had dietary zinc deficiency. But no patient with dietary zinc deficiency had hypocalcemia. That is, if we plus a dietary zinc deficiency and serum zinc deficiency, we had 41% of our series with high risk of zinc deficiency related to parameters recommended by experts. That is, our series is the result of our series is comparable with other population who suffer from zinc deficiency. It's important to take into account that human zinc deficiency depends on soil zinc deficiency. In Spain, you can see in this slide that the human zinc deficiency is low, despite that soil zinc deficiency is moderate. And this is maybe one cause of zinc deficiency in our study, because our patients suffer from chronic digestive issue. Another important result were that there was only 1 adolescent with hypocuprimia, 2 children with hypercuprimia. No patient with abnormal serum copper had hypocalcemia. And copper zinc ratio of 2 was seen in a 6-year-old girl with hypercuprimia. Okay, in this slide you can see the disbalance in our series. There was 94% of our series that had this pattern. That is a high copper and low zinc that is characteristic of an inflammatory condition. This 40% of cystic fibrosis cases with a copper zinc ratio over 1 unit is an indicator of status of inflammation. And at the same time, zinc deficiency should be highly suspected in these patients with high serum copper zinc ratio. Measurement of zinc alone was not show one zinc status. However, the copper zinc ratio is clinically more important than the concentration of either trace metal. Live, laugh, love. In conclusion, this pattern with a high copper and low zinc level indicates in this series a high inflammatory state, which could be to their disease or reflect the severity of the demonstrated zinc deficiency. These results were published in 2 papers in Nutrients Journal, zinc nutritional status in patients with cystic fibrosis, and copper zinc ratio in a series of cystic fibrosis patients. And this is our team. Thank you very much for your attention. If you have any question, I'll be happy to answer them now. Thank you.